Hello everyone and welcome to Physiotrendz. This video you will learn how to do taping for carpal tunnel syndrome patient. In carpal tunnel syndrome, mainly median nerve is compressed over there, and because of that, patient will be having pain around the hand as well as tingling numbness sensation. By applying tape, we are actually giving external support so that the movements can be controlled as well as no extra pressure is given on the nerve. In this video, I am going to teach you two ways of applying taping for carpal tunnel syndrome. The first technique, we will require two tapes. The first tape, we will measure it from the base of the wrist to midpoint of the forearm, that much length, as you can see over here in the yellow color, and that is also slitted in two parts to make it in Y shape, as we will see over here, and that is applied in the thenar as well as hypothenar eminence one by one. And then we apply 25 to 50% of the stress in the middle of this tape. We just pull it and we try to fix it in the end part. Now when you're applying, sticking the end part, that time you don't have to apply any stretch. Just remember that point. After applying, you can just rub it like this so that the tape will stick to the body part very nicely. After that, we will take the another tape which is has to be applied for overpressure on the wrist area. It has to be tied first of all from the center part. We apply stretch maximum and then we apply it over the wrist part. And after fixing it, the end part again we are applying without stretching it. The horizontal strip is also known as decompression strip, which also helps to stabilize the structure and also reducing the pain. We can also apply taping for carpal tunnel syndrome this way, in which also you will require two strips. One strip at the length from the base of the hand to the midpoint of the forearm, and another one which is horizontal strip, which we require at the length of wristband. In next step of this technique, we first cut two holes in the long strip to make sure that we can insert fingers from it. If patient is wearing any kind of ring, then we have to ask them to remove it, because we are going to insert this tape in the fingers and it has to stick to the fingers. Now while applying this tape, we have to make sure that when you insert these holes into the fingers, then we have to ask patient to maintain wrist in extension. And with extension, without stretching the tape at all, we have to just fix it in the front part of the forearm. As you can see, I am not applying any stretch over here and the wrist is maintained in extension. The second strip, which is horizontal, just like the first technique, we will tear it from the center with maximum resistance. We will apply as a decompression tape over here for reduction of the pain as well as stabilization. In this technique, only one more modification we can do is we can apply one more tape in the posterior side or extensor compartment, same way like at the length of base of the wrist to the midpoint of the forearm. Then we again cut two holes in this tape as well, and we insert them in the middle two fingers from the posterior side. In this, we ask patient to flex the wrist joint and apply the tape. So basically here what we are trying to do is we are trying to apply support from anterior as well as posterior direction. This might be more helpful for the patient, especially those who are having acute pain or severe pain. So to provide relaxation and to avoid extra movements, we can use this technique as well. I really hope that you understood this technique for applying taping for carpal tunnel syndrome. If you still have any doubts, you can just let me know in the comment section. And if you like this information, do share with your friends. And don't forget to subscribe Physio Trendz.